Vanakkam, Namaste and welcome to Dr. Shah's clinic. In this video, we are going to discuss on what causes erectile dysfunction in older males. Now, a large proportion of patients who usually visit, a clinic for erectile dysfunction or a sexual health clinic are usually sometimes in the age group of, say between 35 to 45 years of age. So when we speak about older men with respect to erectile dysfunction, we are more interested in the causes of ED or in the causes or in the clinical condition that can cause erectile dysfunction problems in the age group of say 35 years to maybe about 55 years of age, at least with reference to our Indian population. Now for men in the Western culture, the age groups are much higher. So we take a much higher age group of say 40 years and above all the way to 65. So what's very important here to understand with respect to erectile dysfunction in older men is there are three clinical conditions that are very, very commonly associated as well as causative of erectile dysfunction in older men. And before discussing on these three clinical conditions, I would like to cite a study which came from the School of Medicine, Case Western Reserve University, published in the Journal of Urology in the year 2004. This was a brilliant study because what these authors had done was basically they looked at health records of over 272,325 men, that is 272,325 men to be exact, and a large proportion of these men were largely in the age group of 35 years and above. And what they had found was they found that three clinical conditions were strongly associated or causative with respect to erectile dysfunction. The first clinical condition that they found was hypertension. You heard that right. So high blood pressure, also called as hypertension, that is if you have a BP that's more than 140, systolic more than 140 and diastolic more than 90, there is a very high risk of ED, because in this particular study what the authors had found was almost 115,000 men out of the 272,325 men, that is approximately 42% of men had erectile dysfunction because of hypertension. Not just hypertension, even the tablets you take to reduce your blood pressure, that is antihypertensive medication, also lead to erectile dysfunction. And please bear this in mind. So if your family physician prescribes you say you're diagnosed with hypertension and your family physician or your treating doctor prescribes you an antihypertensive medication to reduce BP, what you need to know is you have to ask your doctor if there is a risk of ED or erectile dysfunction or erection problem while taking the particular medication, because there are a lot of BP medicines that actually lead to erectile dysfunction. I'll be making a separate video on the topic. Now, what was the second most common clinical condition that led to ED in older men? Now, in this study, the second most common clinical condition that led to ED was a condition called hyperlipidemia or dyslipidemia. So, if the cholesterol of an individual, that is if the total cholesterol, or better yet, if the triglyceride levels in the individual is more than 150 milligram per deciliter, we diagnose the patient to have elevated triglyceride, also called as dyslipidemia. So a very high level of triglyceride in the bloodstream or a very low level of HDL, which is basically the good cholesterol. If the good cholesterol is less than 40 milligram per deciliter, the bad cholesterol is more than 150 milligram per deciliter, the patient is diagnosed as dyslipidemia. And dyslipidemia leads to erection problem in older men in almost 41% of the cases. So top two causes are hypertension first, followed by dyslipidemia too. So in this particular study, which came from Case Western Reserve University, here again they found that 41% of individuals in the 272,325 men had dyslipidemia. Now, the third most important cause of erectile dysfunction, and most probably this is probably a major cause with respect to the Indian population, is a condition called diabetes mellitus. So I'm sure you're very, very familiar with diabetes. Diabetes basically is nothing but a condition where your blood sugars are dysregulated. There is insulin resistance, so your body does not metabolize your blood sugars properly. So overall, the body is in a state of systemic inflammation. There's a lot of oxidative stress. There's going to be microvascular abnormalities, macrovascular abnormalities. Now, rather than complicating things too much, if you're diabetic, definitely you will end up with erectile dysfunction one day or the other. And this particular study, which came from Case Western Reserve University, suggested that when they looked at the healthcare records, they found 20% of the 272,325 men, that's roughly 55,000 men out of 272,000 men diagnosed with ED as well as diabetes mellitus. So 55,000 men had diabetes mellitus in this particular group and had ED as well. And apart from these three factors, about 11% of men, especially men who were slightly in the younger age group, maybe say less than 35 or somewhere in the range of say 30s to 40s, had clinical depression as a diagnosis of ED. So they had clinical depression which led to ED. So hypertension, dyslipidemia, sugar, that is diabetes mellitus, along with clinical depression, all are probably the top causes of erectile dysfunction. And not just that, at least with reference, now this is a Western study. Now if you look at the Indian studies, or if you probably look at the pattern of patients who come to a sexual health clinic, what we normally tend to see is diabetes, hypertension and cholesterol problems, along with a condition called metabolic syndrome. So metabolic syndrome is a condition where men are, have diabetes, hypertension or cholesterol, along with an increase in the waist to hip ratio. And if the age of the man is usually more than 40, there's a very, very high risk of ED. And what happens is, the patient comes to a complaint to a sexual clinic, stating that he has ED or erection problems, and we tend to diagnose either of these three conditions or a combination of these three conditions, which results in a metabolic syndrome. So metabolic syndrome is characterized by elevated blood pressure, elevated triglyceride, and increase in the waist to hip ratio. And metabolic syndrome is a high risk marker for coronary artery disease. So normally what happens is, in a sexual health clinic, we tend to screen if a patient comes to the clinic with erectile dysfunction. The first thing we do is test and assess the blood sugar, the cholesterol, we measure the BP, we estimate the waist hip ratio, and we also look at the male sex hormones, and we also assess coronary artery risk factors, other coronary artery risk factors, as well as we have an assessment for the overall risk of, for the patient developing future coronary artery disease. Because erectile dysfunction and metabolic syndrome, if they are present hand in hand, it signals that the patient has endothelial cell dysfunction. It also signals that there is a very high risk of the patient developing heart attacks or myocardial events, anywhere from about 5 to 7 years from the point of time this diagnosis is made. So I hope you enjoyed this video. We have comprehensively covered the causes of erectile dysfunction, or at least the most major causes of erectile dysfunction in older men. Please comment, like and subscribe, share this video with all your friends and loved ones where relevant, and if you have friends who are older than 35, or if you know people who are older than 40, please share this video with them, because it will be very, very useful. But most problems with erectile dysfunction can be resolved through very, very simple lifestyle changes, controlling the sugar, controlling your body weight, healthy exercise and fitness, and it's very, very easy to treat erectile dysfunction. It's not as complex as you think. So I hope you like this video. Please like, comment and subscribe. I'll see you back with another video shortly. This is Dr. Shah. Vanakkam.